Good afternoon, ladies and gentlemen. Let me introduce to you my 9-month progress. My PhD topic is the role of knee injuries in the development of osteoarthritis. My name is Miklós Máté. I'm a third-year resident at Uzsoki Street Hospital, the Department of Orthopedics and Traumatology. My vision is to bring along and also to develop our center, which has already well known for its cartilage care and repairment. And my mission is to help decision-making for daily practice and to have a more clear picture about post-traumatic osteoarthritis. I have 2 ongoing projects. In both of my projects, we are investigating post-traumatic osteoarthritis after ACL injuries. My first project is a meta-analysis. We compared conservative and surgical treatment after ACL injuries, and we are on the phase of manuscript writing. We have chosen a D1 journal with the impact factor of 3.021, and we are on the phase of finishing the article draft. About the background, ACL injuries are one of the most common sporting injuries for young and healthy patients. Almost 130,000 ACL reconstruction made yearly in the US. The prevalence of osteoarthritis after ACL injury is up to 50 to 90% in a 10-year study. But based on the recent studies, the superiority of surgical treatment compared to non-operative is low. Our aim was to analyze short-term osteoarthritis after ACL injuries. Our clinical question was quite simple. Does surgical treatment decrease the incidence of post-traumatic osteoarthritis? Our patient group were the ones with ACL ruptures, and we compared surgical and conservative treatment. We have made a systematic search with that search key, and we found 7 eligible articles. About the knee osteoarthritis outcome score. It's a patient-reported joint-specific score, which is assessing changes in knee pathology over time. The scores range from 0 to 100, 0 indicating the worst case scenario and 100 indicating no knee symptoms. This score assessed patients in 5 scales, and we made through with these 5 scales with the 2 articles we could compare. Interestingly, only one has a significant difference, which favors surgical treatment. This was the quality of life. On the other 4, the pain, the symptoms, the function of daily living and function in sports and recreation has no significant difference between these 2 groups. We have made another table from the used MRI grading systems, and we have 2 interesting findings there. One is that most of the structural changes exist and can be seen on MRI after 2 years, and second, that there were no significant radiological difference between these 2 groups. The strengths of our study that this is the most comprehensive study in this topic, and also the first meta-analysis in this topic. The limitations were that only 2 comparable RCTs have found, and there wasn't any comparable radiological outcomes. And also, as I've showed on the other table, that the high variety of grading system was limited our work. In conclusion, young and active adults with an acute ACL tear, a strategy of ACL reconstruction could be an option, and also another important thing, the structural changes appear to develop in the first 2 years. The implication for practice is that conservative treatment should be considered, and the implication for research, it's advisable to have more randomized trial and to use standardized assessment to make outcome comparison easier. Based on our first study, we are building up an MRI follow-up study with isolated ACL injuries. Only limited data exists with isolated ACL injuries, but based on a recent study, cartilage deterioration can be seen early after the injury. Because of the high impact nature of this injury, the subchondral edema demonstrated on MRI more than 80%. And also the outcome, of prevalence of short-term studies were highly variable. We also had an own study where we used this protocol, and we have seen patients with that protocol with X-ray, and we found significant lateral joint space narrowing in our patient group. Our clinical question here was, we had two clinical questions. That does ACL reconstruction decrease the development of osteoarthritis? And also, we are keen on to know that transtibial tunnel positioning affects the developing of osteoarthritis. The patients are the ones with isolated ACL ruptures, and we are comparing the injured knees and the contralateral healthy one with each other. Our hypothesis is that ACL reconstruction is contraprotective. Our clinical implication is to understand early osteoarthritic changes in post-traumatic knees. We made general eligibility criteria. We have chosen young, active, and healthy patients. You can see the age group, and also the Tegner activity score indicates the activity of a patient. And we have made all the other eligibility criteria. Our primary outcome is to see the early signs of osteoarthritis, like bone marrow lesion, proteoglycan depletion on MRI. But also with this, we are using questionnaires to fill with our patients, and also would like to see not only the radiological but the subjective scores on developing osteoarthritis. We would like to know in the longitudinal interrelationship between altered tibial position and early degenerative change, and we would like to compare the initial bone marrow edema extension with the follow-up 2 or 3 years after the surgery edema also. Well, here we are now. We are almost finished our meta-analysis, and the other project is still ongoing. And lastly, I have a quote from Confucius: "It doesn't matter how slowly you go, as long as you do not stop." Thank you for your attention.
In your second study, I'm not an expert, far not an expert on this. So I just wondered, what is the time frame of this when you do this? Because probably this is something which happens by time.
We have an entry point, which is when the injury happened. We made a comparing MRI with this. We have a 6-week MRI after the surgery. 6 weeks after the surgery. We made research, and the first MRI signs of osteoarthritis could be seen in 6 weeks. After 6 weeks, when the patient starting the weight-bearing exercises, we made it in 3 months, and after 3 months, we made 1 year, and from that, we are planning to get in every 6 months. So this is our plan to follow up the patients. I didn't make a... It's really hard, not only actually to get patients to come at Friday 8 in the evening is really hard to get, and especially with the both knee MRI, which is almost an hour. It's really hard, but we try to manage it, and I think we have good results. Not only we are working in a little team with Dr. Dajunger with this team, and also Dr. Panic is our supervisor, and our recent results could say to us that it has some importance, and we try to manage to have enough patients to go through with it. I always say in the progress report that this is a precise patient group. We do the surgeries, so we follow up really closely our patients. So hopefully we could manage after 2 years that we have a good data and good results after that. Thank you.
I will have a question if you don't mind. You said that between the two groups in your first project, those who were operated and those who were not, the only significant, if I remember, different was life quality, right?
Yeah.
First of all, what was the questionnaire that you used? And second, what does it mean? What questions did you use?
The questionnaire was that knee osteoarthritis outcome score, and actually, in terms of quality of life, it has quite an interesting questions like when you wake up, how do you feel yourself? And there were 19 different questions. I cannot say all of these questions, but the person who made this questionnaire just have all these questions. But these are common things, like when you actually there were one that when you wake up from the toilet, how do you feel, or how do you so it was like, can you wake up after that? So
don't go more
really
precise, please.
but I mean, I just wanted to say that yeah, it's a 19 question questionnaire, and it's not sports related, and quality of life was what made significant difference. Sorry for that. I didn't know all the questions, but I remember that there were questions like this. So.